Jack. Welcome, everybody, and thank you for joining us for this inaugural seminar of our Focus on Family and Disability seminar series. I'm Tamara Norris, and I'm the director of the Family Support Program here at the School of Social Work, and we really are delighted for the opportunity to be doing this experiment, as Jack said, as part of the clinical lecture series here at the school. Just a brief word about who we are. The Family Support Program promotes and provides support for families with children who have special needs, and we are affiliated with regional programs across the state who work directly with families in their communities to provide information and referral, parent-to-parent support, support groups, and so forth. And we at the Family Support Program provide technical assistance and training and consultation and model program development around supporting families. In your packets today is a one-page information sheet about our values and our activities, so please take a look at that. We've developed this series really as a forum for experts, and we consider experts to be people with substantive expertise in lots of different fields related to family and disability, and family members themselves who bring their own type of expertise to the notion of supporting families who have a child with a developmental disability or special needs. So we have invited people from a range of disciplines to be here, and we hope to have people from lots of different disciplines to present and share their perspectives and their expertise. We want the seminars to be very relevant to you and to the students who are in the audience, faculty members, service providers, clinicians, and family members. So to that end, please do complete the evaluation form that's in your packet today. We will look at that feedback very carefully, particularly if you have special issues you would like us to focus on, or if you have suggestions for speakers. We welcome that input. Since we are launching today, I just want to take a moment to thank the people who made this happen. Super thanks to Debbie Barrett, who directs the clinical lecture series for the school, who really did show us the ropes, and to John Anderson, who took care of all the technical pieces for us, and to Andy Chrisman and Cindy Justice, who met you outside, Beth Sauer and Vanessa Mitchell, who always step up to do whatever needs to be done. And so thank you all, and especially to Dean Richmond for really coming up with the idea for the seminar series and being so supportive. Other pieces in your packet today are handouts that Sheli will describe. And the PowerPoint itself will be put online at the Clinical Lecture Series website where you registered, and I believe also on the Family Support Program website as well. Please take a note of the listing that we have also in the packet of all of the upcoming seminars. We have a fabulous group of speakers lined up between now and March. One of whom is in the audience with us today, our own former faculty member here at the School of Social Work, Chris Egan, who is now the executive director of the North Carolina Council on Developmental Disabilities. So Chris will be with us on October 14th to talk about his vision for the DD Council here in North Carolina. So thanks, Chris. The presentation today is being recorded. So what we'll do is have Dr. Reynolds give her presentation. If we can hold questions till the end, we'll have a question and answer period, and we'll ask that you use the microphone so that your questions come up on that recording. So I think that's the housekeeping, and I am now delighted to introduce our speaker. Dr. Sheli Reynolds is Director of Individual Advocacy and Family Support at the University of Missouri, Kansas City Institute for Human Development, which is a university center on excellence in developmental disabilities, or USED as we refer to them. She directs projects that impact the lives of self-advocates and their families through policy and practice changes, and also directs the Missouri Parent-to-Parent program, which is kind of a parallel program to ours here in North Carolina, and provides technical assistance to state advocacy organizations. The impetus for Dr. Reynolds' passion, knowledge, and experience came from growing up as a sibling of a younger brother with developmental disabilities. She has a doctorate in public administration and sociology with a focus on family support research and policy for families of individuals with developmental disabilities across the lifespan. Dr. Reynolds is very much in demand as a speaker and consultant all across the country these days. She was in Washington with the President's Group 2 days ago? Last week. And then she came home and finished up writing a federal grant proposal. So she's very busy. She's all over sharing her vision for people with disabilities and their families. And so we are so pleased that you are here in Chapel Hill today. So please welcome Dr. Reynolds.
Well, I am really excited to be here. It's an honor to be here on the opening one. I did arrive really late last night in the midst of rain. So I'm hoping to come back and actually be able to see your beautiful state because needless to say, I'm not going to be able to see it today or on this trip. So I'm going to just take a minute to get used to this. Is it working? Is it on? It's all right, I can skip it. All right. So as I mentioned, this is my family. The first and foremost, the most important thing, it's really hard as a speaker to have to sit and listen to those introductions, but this is me. This is obviously we're Cardinals fans. We're from St. Louis, although I live in Kansas City, so I have to kind of start with that. And this is really what it's about. Really, most of this comes from my experience of growing up as a sibling, and then had the honor of being able to work alongside self-advocates in the self-advocacy movement. And that's a constant reminder to us that that's why we're here, that's why we're practitioners, that's why we're professionals, that's why we're talking about policies. It's ultimately, we're talking about people's lives, and we're talking about the lives of the individuals with the disabilities, but we're talking about their families as well. And so, for me, everything comes back to that. It's kind of ironic he's in a light blue shirt, but it's not just so I can point him out. I have no idea why he's the only one in a light blue shirt, but that's Eric. And that's where a lot of my experience comes from. But it also comes from my twin brother who stands in the middle in the back, and my older brother who's standing behind Eric. And then very clearly my parents have really modeled for us a full inclusive life for all of its members and what that looks like. And now we have all these grandkids to throw into the mix. So I also, over the last 3 or 4 years, have had the privilege of really being able to go inside some state systems and really understand policies and how policies impact the lives of people, and to really actually understand it from a practitioner or a professional's point of view too. And so as we're building change and thinking of how to improve things, we need to always be thinking about the end user, so to speak, in mind. And so I think it's really important to do that. I will tell you is I still feel like I'm a kid in this field, and I remember sitting in the audience when I started 18 years ago at our university at program thinking, people talk about policy. We're not here to talk about policy. We're talking about training, or, I didn't really understand it. But now that I've been involved for longer, that really everything we do comes back to policy changes. And so even though you don't think you can impact policy, everyone in this room can and should be impacting policy, and especially right now because there's a lot of policy changes going on. I also have the opportunity to be a part of a national initiative that's really kind of what I say, peeling back the onion on the concept of looking at supports for families across the lifespan. And I do it in partnership with a lot of national organizations listed here, but it's funded through the Administration on Intellectual and Developmental Disabilities. And it enables us to go inside 6 states and to really say, we don't have the answers. We don't really know what the future holds for our field and for families, but we need to work on this together. And so in these 6 states, they formed teams of people from their state service systems, their early childhood programs, their DD councils, family networks, and family organizations, and said, okay, let's try to figure this out. Let's try to figure out the services and supports that need to be in place. Let's figure out the types of policies we need to change to really impact that and to really ensure it's what individuals and their families want and not just something we think is a good idea. So in that, we're really kind of, like I mentioned, trying to kind of, just because we chose these 6 states, the idea isn't just to stay in those 6 states, but to be learning from what's happening across the nation and quite frankly, across the world. You know, a lot of countries are in the middle of really turning their service systems upside down as a nation. Australia, a number of years ago, decided we're starting it over. We're completely redoing our service system across our nation and how we respond to disability, and they started over. So when we sit and we talk about policy changes being impossible and it's just the way it is and this is what we got to deal with, the world is really changing, and people are saying, we created something that we don't want anymore, we need to create it better, and we can't do that incrementally. So it's interesting to watch what's going on around the world. But we really hope that what we learn is being shared because we work with the National Association for State Developmental Directors on Disability Services, NASDs. We're sharing this learning across the country through these other leaders who are also hopefully implementing some of the policy changes as well. So I'm standing here talking about policy a lot, and you're thinking, oh, I didn't want to come talk about policy, but really the entire presentation is about practical understanding and how we can use practical words and use a practical framework that really guides our understanding, specifically developed for individuals with disabilities and their families to use the tools, but then how can we then use that same model when we're working with practitioners and also with policymakers. So we've really tried to flip it upside down because typically we develop policy, then we try to implement it. But instead we wanted to develop a framework that made sense to families and then teach the other systems how to use it. So the first concept is this concept of all. And it really struck me when I first started working in Missouri's service system 4 years ago. I remember our first meeting with a group of like 30 professionals who were sitting around the table. And I said, you know, as a family member, when I'm here to talk to you and I start talking to you about family and family supports, I'm thinking about family in the most broadest sense of all families that have a family member with a disability. And I said, what do you think about? Who are you thinking about? And they stopped and thought for a second, and they started throwing back professional jargon. And what they started to say is, well, we kind of think about people depending on what waiver slots they're in. Or we start thinking about people in terms of what residential structure they're in. Are they in the group home? Are they in the big ICFMRs? Are they living at home? And that's how they talked about people. And I said, you know, that's not how families think about themselves. And so if we're really going to understand supporting families, we got to start understanding families from how they see themselves. And quite frankly, how many families even know what waiver stream they're in or what funding source pays for different services? But more importantly, what it did for me is I started looking at the national data. And there's a lot of national data out there, and we talk about disabilities, and we talk about the disability data as if it represents everybody. And in reality, the national data sets only represent 25% of the people with disabilities out there. And so when we start talking about systems change, that's really good. We need to improve our systems, but those systems only touch 25% of anybody with a diagnosis of a developmental disability. Only 25%. And so when we're talking to legislators and we're talking about our wait list and we're talking about the need for more funding, we're still really only talking about it in terms of the people over there on the 25%. So we're never going to financially be able to figure out how to fund 100%. So that means we have to figure out how to do something very differently. And then we also need to say to ourselves, why aren't those 75% getting those services? And we also not always need to go right to the negative. Maybe they don't want those services. Maybe they don't need those services. We also make this big assumption in our field that because they have a disability, they have to need us. All right? That's why we're here. That's why we have this field. I mean, why didn't you go to your service system and get hooked up? And it's the first thing we say to a family when we find out they have a kid with a disability. And so we need to kind of start thinking about the way we respond to people that have a disability. We also need to, and from a researcher, this really challenges all of my colleagues, we only know and research stuff inside the service system. So we think we know the answers, but we only know the answers from inside the small part of the triangle. Why haven't we gone and researched what's really working out here and then try to duplicate that inside our service systems? But we don't do that. So this concept of all is going to resonate throughout the entire day, and I'm going to constantly bring it back to you, because when we're thinking about solutions to good lives for people, we got to think about people on both sides of that triangle. So our solutions aren't always formal service system driven. We've got to figure out how we're touching the 75%, even if we never actually interact with them. And so I hope to talk a little bit about that this afternoon. I have different states, just to kind of give you an example, and I apologize, I do not have North Carolina, but I kind of wanted to show you how Missouri breaks down, because then when we go in and we work with a state, we take their data, their number, and we start saying, based on prevalence rates in your state, you have about 95,000 people with developmental disabilities across the lifespan. So when you're standing in front of your legislators and you're talking about the 33,000 people that you know of, you are actually leaving out 62,000 people. So as a legislator, when I'm making decisions, I probably only think there's only 33,000 people out there with disabilities. And how can I help those people get the services they need? So as a legislator, you don't give me all of my information. Because if I only keep funding direct services, how am I ever going to start reaching all people? So in the state of Missouri, different states are kind of funny, because some have waiting lists, some don't have waiting lists, but some also kind of have other words, but it's the same group of people. And what I call that group of people is the people in our system that have services, and the people known to our system who don't have services. So in the state of Missouri, we have 16% of the people that actually receive some sort of Medicaid waiver service or some sort of general revenue funds. But we also have 19% of the 33,000, or excuse me, 19% of the all, that receive what we call targeted case management only. So when we're talking, and I'm talking to people inside our service system, they say, well, we serve 33,000 people. And you start really looking at that number. I talk to families that are getting targeted case management only. Do you think they feel like they're getting services? They don't. They feel like they're on that waiting list, even though they're not on a waiting list, because they're technically getting targeted case management. So I just kind of want to show you that even though our numbers are high of 33%, when you start looking inside the 33%, 19 of them are getting targeted case management only. Now, if I move to Oklahoma, and we're working on, with their governors, they put together a committee on the wait list. This is their numbers. They have approximately 60,000 people with developmental disabilities in their state, based on the prevalence, and they serve 15,000 of them. They have a waiting list of 7,000 people in their state. Well, so then you say, oh man, their waiting list is a lot bigger than in other states. Man, what are they doing wrong in that state? Well, technically, they know the names of all the people. The 7,000, they have their names, they have their ages. But in their state, they don't get any sort of case management unless you actually are getting Medicaid waiver services. So the only difference in their state is they don't have an assigned case manager to them. So it's a different way to start looking at them. So when we start thinking about the outcomes for all, we need to even stretch it a little bit further. When we're talking about people, regardless of whether it's people with disabilities or not, their outcomes are life outcomes that you and I want, and that everybody wants. And so how can we really start thinking about that? So the sort of underlying statement that really guides our work is that people have the right to live, love, work, play, worship if they want, and pursue their life aspirations as everybody else in their community. So the framework that I'm going to talk about, really, you could technically get rid of the phrase with disabilities. It's what people want in their lives. So to do this, we've been talking about the need to really think differently, because we continue to respond the same way in our service system and go, why isn't anything changing? We're not getting caught up on anything. People are still in crisis. People are still in need. People aren't having good lives. And so in the conversation that's happening across the country is this really, really need to reframe both the issue and the way we respond to it, which requires us to use different words and to think differently. So I don't know if any of you watch TED Talks or if you've seen the Simon Sinek TED Talk. He talks about the golden circles. And this is not a disability thing, it's just an organizational thinking kind of component. And I think it really applies. And so I kind of arranged my presentation using the golden circles. And if you think about what you are probably learning in school and what you do on a day-to-day basis, we spend most of our time thinking about what? Our outputs, and we're worried about our have we documented, have we been trained, are there any med errors, all these types of things. So most of our energy focuses on what we're doing, and we often forget about why we're doing what we're doing and how we're doing what we're doing. And if you have the chance, and I'm not going to spend the 16 minutes to do it, I really encourage you to go to this powerful presentation on the golden circles, because I use it to think about my own life and what I do and why I do it, but I also use it to guide our work when we're working with organizations or systems. And so some of the things that he always talks about is that, you know, I'm not here to tell you what you need to go change, but I'm here to really get you to focus on the why you do what you do and to give you some guidance on how you do it, and then how you go apply it is really up to you, each one of you. And so he talks about, you know, if you believe in what you're doing and you believe in the why, the rest of it basically will come with it. And one of my favorite things that, obviously I'm totally condensing his talk into a few sentences, but one of my favorite things that he talks about is if you think about people didn't come to see Martin Luther King Jr.'s I have a plan speech, he came to the I have a dream speech. And so that's a paradigm shift. That's not coming with a strategic plan, with a train the trainer model that tells you how to do it, but rather how to really get people involved in why we do what we do. And the why we do what we do is to give people real lives. So our I have a dream speech is that we all have the right to live, love, work, and play like everybody else. We hope to do this through framing our thinking and our actions differently. So in 3 years, I've watched the service coordinators and the policymakers in Missouri go from only thinking about 33% to now realizing when they make policies, they need to be thinking about the 100%, even if they're only funding programs with inside the 33%. I've listened to service coordinators now say, you know, I used to only be here for that person, but now I understand they're part of a bigger system and they actually live in a community. And so it's just to help give people the tools to have that thinking. And so hopefully by thinking differently, we can start reframing the supports that people are receiving in their lives. So how do we make this a reality? So don't think disability for a second. Think about your own lives. And you think about your own lives in terms of really 3 social ecological levels, right? Yourself, your relationships, predominantly with your family and your close friends, and you exist within a community. And what's interesting is if you start thinking about it, we have, I'm going to skip forward for a second. In our field, we've taken our service systems that we've built over the last 50 years, and we've wrapped them around people. I mean, we even use names like wraparound services, and we've done all of this stuff to really give people specialized supports that they need. But if you really sit and look at those circles, our services have actually cut people away from their communities and their families. And so it requires us to think very differently about what we have built as a profession, what we've built as a field. Do our policies segregate that person and alienate them from their family and friends, or does it include them? You know, I use the example all the time of when my brother was in high school, and he had a para with him that never left his hip. So although he was included, right, he was included in school, he was there, his paraprofessional never left his side. So what did that do to the other high school students? Do you think other high school students wanted to come talk to him, eat lunch with him? Do you think the girls wanted to come talk to a high schooler if there's always a mom right there or some other, you know, adult figure? So it really challenges both as families and as policymakers to really be thinking about, is this service alienating them from their families and their communities, or is it including them? But the reality is, I come from a person, Eric requires supports. He will always require supports. So I don't want that service circle to go away. but we need it very differently in our lives. So what we're hoping and what we're proposing is how can Eric be a part of his family and his community, and how can we put supports in that adapt and accommodate to where he exists in the life that he wants, and not actually become the barrier to him being included in those types of things. So what we're going for here is this star. I will tell you, on the right-hand side of your folder, there's the infographic of like what I think are the main points of today's talk, and those 3 circles are on the back of that. So I'm going to go backwards a little bit. The other thing to think about, and don't think disability, is to think about the fact that everyone lives within the context of their family. And so that means lots of different things. And what's actually really, really sad is that I have to put that slide up there. And the reason we have to put that slide up there is because of the service system that we've built over the last 50 to 100 years. When we built that system, what we did was we removed a person from the context of their family and their community. And quite frankly, we still have policies that continue to really perpetuate that. Even though we don't say it, people live in their community, we don't often talk about the role of the family or the impact of the family. So again, think about the fact that everyone's a part of their family for their entire life, regardless of where they live. And so when you're younger and you're starting off, your family plays a pretty strong role in your life, and then as you get older, you may move in, you may move out, and it's not that perfect, but you have this sort of connection with your families, sometimes good, sometimes negative. But in our field, when we had the big push for independence, we started saying independence meant on your own, when in reality, none of us live on our own completely. You know, my dad lives 300 miles away, but when my air conditioner breaks down, even though I'm married, who do I call? Dad, listen to my air conditioner, it's broken, right? Who do I call when I need emotional support? My mom. So I do not have to live in my parents' home to be a part of my family system. But our field does not recognize that connection. The other thing is we know that the definition of family is evolving and it's changing. And we know that's happening across the world, but we also know it's happening in the United States. But it's particularly important to think about defining family, because there's not a talk that I give where someone does not raise their hand to me and say, oh, all the people I support, they don't have family. And I almost get sick to my stomach every time I hear this, because why do they not have family? Do they not have family because we ripped them out of their family homes and told the families to go away and we'll raise them in the institution? Do they not have family because the families didn't have the support they need when the family or the child was growing up and they just can't do it anymore? Why does someone not have a family? And so what saddens me and makes me so sick about that comment is if that's the reality, then what should be the number one job of that professional? To help them develop a family, to help them develop someone that loves them and that is committed to them, whether it's blood related or not. And so to me, to throw out, oh, the people I support don't have family. So that means they have 100% of people in their lives that are paid. And that is really sad to me, and that's what saddens me. So we think about a fact of our family and how they impact us, good and bad, but they have a lot of impact on us. So we need to know this for several reasons. Whether my family's in my life or not and you're supporting me, you need to understand my family and how I was brought up. Do you understand my cultures? Do you understand the way holidays are? Do you understand how I have to have the dining room table set up because that's the way my mom always did it? Do you understand our silly jokes? Do you understand our traditions? Do you understand the expectations our family unit had for its members? If you don't understand that, how can you be providing me person-centered supports? You have to understand that. And you also have to understand that if I grew up in a rural community on a farm and you're a VR counselor and you come in and tell me I have to have a job in the community, that might not make sense to my family and to my family system. So you have to understand the environment that I came from. There's an individual that one of my colleagues is a part of his life, and he has both he has a number of labels, and he requires 24-hour supports. And he's an African-American gentleman, and he wants to live. He's bought his own home about 30 years ago. He lived in an institution for about 25 years. He both has deafness and blindness and has autism. So we're talking pretty significant support needs to understand his communication. And the service coordinators want him to sell his house. They don't think it's safe for the staff to go there. So why aren't we moving him? And the service system just cannot understand why we're refusing to make him move. Well, it's just not safe. Well, safe for who? This is his community, this is his home, this is where he grew up with the people and the neighbors that know him. So it's really interesting how we go in and make judgments about safety based on our perception of it. So we really need to understand the environments. And down there I have it under policy because I use this slide for something else too. There's a lot of policies that come from your family home, right? You might have policies about the way you respect other people. You might have policies about your expectations of going to college. You might have, and so you don't call them house policies, but you got a lot of rules you grew up with in your family home. Some that you want to try to do the opposite for when you get older. Some that you follow, but you have a lot of different things like that. So we also need, and this one I think is really important to think about, is that we talk about human development a lot, right? And so we talk about the individual with a disability, and we focus a lot on their transition stages, right? We talk about early childhood to school, and we talk about transition to adulthood, and it's all about the person with the disability. But the reality is that person exists within a family system that's going through its own family cycle. So I think about my parents who are in their 60s right now, who are at the part of the family cycle of all their peers without kids with disabilities. They're retiring. They're not providing care to an adult caregiver with a disability. They're not doing the same things they did back when the child was 5 that my parents are having to do to someone who's 32. And so when do they get to retire from caregiving? When do they get to experience the family cycle of the peers? And so we must recognize that as we're changing our policies and we're doing different things, and as we look at our numbers, part of the thing I forgot to say earlier when I was talking about we talk about 25% of the people receiving services, but 50 to 70% of those people that have services are getting them in their parents' home. And so in reality, many people, if you start adding up the number of the 75 with the other number, that's 85% of all people with developmental disabilities are somewhere living with a family member. And so we need to be recognizing the family cycles. Before we came here, were having a meeting, we were talking about siblings. Where do the siblings fit in these family cycles? Do they get to start their own family cycle? Or are they worried about aging mom and sibling who requires 24-hour supports but doesn't have them? Do they get to have their own family? And so when we go into a family home, we need to be thinking about, and not that everybody has a typical family cycle, but at least gives you a starting point, what is that family experiencing? So if I walk into a home of somebody who's up in this older age where all the other adult children have moved out from that age group, and the mom says to me, I'm worn out, and we go, sorry, it's the way it is, but do you want to self-direct? We have to understand where they're at in their own life and not just where that individual is within that family home. We also need to recognize the reciprocal roles of all the family members. And if you notice up there, this doesn't say person with a disability and the family's roles, because every one of us, no matter where we're at in our family and whether we have a child with a disability in our family or not, there are times where we go through all these roles throughout our lives, right? There's been times where my twin brother needed a place to stay and moved in with my husband and I. He didn't have a disability. There's been times where my mom's been really upset and needed to talk to someone on the phone. I provided her affection and self-esteem. There's times when maybe some people need money. There's times where some people are really sick and you got to go care for them. So we have to start thinking about the reciprocal functions of family members and not just thinking about the role that families play to the person with the disability. One, because it disrespects that person with the disability as if they brought nothing to that family. And we've got to stop doing that. Eric shows us a lot of these things at different times of our lives. There's things he's doing back home in St. Louis because he's with my parents more that maybe helps him for the caring for side. So we need to be thinking about caring for and caring about. And the reality is that the caring about one is so much more important than the caring for. but all of our policies, all of our conversations, and all of our supports only focus on the caring for side. So I met with a group of parents that were in their 90s in St. Louis. They called and said, can we talk? They said, it's time that we start thinking about the future of our adult children with disabilities. And they said, I think the average age was 93 in the room. And they said, so we got to figure out where they're going to live, who's going to provide their care, how they're going to get their money. That's what they wanted to come talk about. So I went and I took this slide. It was the only slide I took. And I said, those are really important things. I said, however, who cares about your adult children? Well, no one does. That's why we're here. Figure all that stuff out. And I said, well, let me tell you something about the way the world works, is that it's constantly changing in everybody's life. So people with disabilities aren't immune to that change. So just because you think you set something up, maybe they don't want to live there any longer. Maybe their service system changed. Maybe their funding stream changed. Who's going to help them adapt and adapt to all the changes that might come at them for the next 30 to 50 years of their lives? The room got quiet because they hadn't thought about it. Because they're more concerned about the caring for, which we have a tendency to focus a lot on. And I said, what I want you to do before the next time I come back is I want you to go back and I want you to figure out who cares about your sons and daughters. And then you bring them back into this room, and then we can talk about ideas that you have about the caring for that maybe they can make and sure happen when you're gone. The other thing that this slide does for people is it breaks out the function of the role of a family, and particularly parents. These are the things that keep them up at night when they have a child with a diagnosis. It starts very early when you get the diagnosis as what's going to happen when I'm gone, right? And we know that nobody can do it as good as the parent can, right? So even if there's people that have offered to step in different roles, often moms and dads are like, oh, but, right? It's not me, because it's a thing that we do. And so what it does is it enables them, I said, start taking each one of those things apart. It doesn't have to be one person. And it was the first time they thought about the fact that one person doesn't have to replace them. Just because they are the one person in their sons and daughters' lives, it doesn't have to be one person that comes in and does that. So like I explained in my family, the reality is my twin brother and my older brother, they don't want to know anything about the service system. They want to know the way it works. They think those meetings are ridiculous. They just don't want to be a part of it. Not because they're mean, but just because it's a weird world we live in. So probably I'll be in charge of the day-to-day supports for Eric and really figuring out what that looks like. The reality is my twin brother just wants to be a sibling. He just wants to love them and enjoy them as a sibling. So you know what? He'll probably predominantly stay in the caring about part. So it's important to be thinking about, and when you're planning with a family, you could take this slide and say, let's list all the people that fulfill these different functions in the life of your child with a disability. And wow, now it's not just one person, there's 15 people, but they all have different functions in their lives. So now your daughter knows who to call when her air conditioning breaks and dad's not there anymore. Now she knows who to call when you need to advocate because they're in the hospital or they're having problems with services and supports. So I spent a lot of time on this slide, and I think it's just really important to really think about all those things. A mom came up to me after I gave a presentation, and she said, I have an adult son, I have adult twins, one with a significant disability, and it never dawned on me that the twin brother without the disability is really his caring about, because I'm always thinking about how is he going to care for them when I'm gone. Is he going to take over responsibility for Ben? And she said, sometimes I need to really, really just recognize what an important role it is that he's there as his loving brother that's committed to him. So I alluded to this earlier, but these are a lot of things that professionals have a tendency to say about families, right? Oh, they don't have families. Oh, they're the barrier. The family is the barrier to that person having lives. Now, I'm not saying that sometimes these things aren't true, but these are what we use as an excuse as professionals as to why things aren't working. The families are too tired and overwhelmed. I can tell when I go into their house because it's chaotic. Well, I'll tell you, if you ever come into my house from 4 to 6, It's chaotic too. And if you were going to make a judgment about whether I could pick up one more type of responsibility, it would probably look like I couldn't. But who are you to decide for me? And that's what happens a lot, is when professionals walk in and they see a family system and they think to themselves, I couldn't do this. How are they possibly doing this? They don't offer all the information because they think they're too overwhelmed or too tired. And that's an unfair thing to do to families. This is the perfect, because parents and family members, we can never win. We have half the group going, oh my gosh, she thinks that kid's going to work and live in the community? She's crazy. Who's going to let her know that her expectations are too high? Or the other side is she doesn't think he's going to amount to anything. So there's never a happy medium about the expectations we as family members have. You will find a reason somehow to think that it's not in line with what's really going to happen. And that's really hard on families as well. So what can we change? What can we do differently? I've already gone over those slides. So about 4 years ago, a group of national family leaders came together and said, do you know in the field of developmental disabilities, we do not have a definition for family support? And it was like, wow, we sure don't. But we've got data that we give to legislators. We talk about it like everybody knows exactly what it is, but no one has ever defined it. So many of you have been in school. If you don't have a definition, how can you operationalize it? How can you put it into practice? And even more strange, if you haven't defined it and you haven't said what it was, how can we possibly have data on it that we're giving to legislators about how much we're spending and what services people are getting? So that was sort of the conundrum we were in when we got together and said, we've got to start defining this. We've got to start understanding what family support phrase, what that phrase means to us in our field, what it looks like, and how we can do it better. And so if you think about it, family support started as a program, and it started as a very specific program with eligibility. So the second you put the word eligibility on there, you just took that triangle of all and you just made it really small, right? The other thing it did was it was very specific. Although it says caregiver or parent up here, it really was mom. And we did it to mom because what we really wanted, this really wasn't for mom. What we really wanted was for her to keep that kid at home as long as possible so that it did not become a burden to our state service system. And it's actually written in many state laws. It says that specifically. Let's provide support to the family unit between the age of 0 and 18 because that will decrease the chance of them coming into institutional support needs. So it wasn't even written with the intent of creating strong families. It was very much written with the intent of saving the service system money. And so it was also very crisis-driven. Only people that were in crisis would need this because remember, we've got to prevent them from not giving their child up to the supports. The other thing the family support movement did when it started, and I actually think that this is part of just the natural tension between a child and a family, but if you think about the movements, is that the parent movement was really strong, right? Started in the 1950s, and then the self-advocacy movement came around in the 70s. And so in order to become independent movements, you kind of needed to push the other movements away, right? So when you're a teenager, yeah, you're a part of that family system, but you don't want to acknowledge them, right? You don't even want to know them. You're trying to become as independent from your mom and dad as possible. So I think there was a lot of tension between the self-advocacy movement as it was growing and building and becoming an independent movement, and it couldn't do that if it was always underneath the family movement. And so there was a lot of tension between those two movements, to the point that we were at a national summit where we were bringing this together. KU Beach Center brought people together like 5 years before we brought people together to have this conversation, and people weren't ready for it. It ended in a big, huge fight between families saying this is what we know people need and the self-advocates saying, but this is what we want. And there could not come to agreement on it. So when we started looking at it and started defining it, the first thing we said was it can't be competing definitions against movements. It's got to be what can the family system need and get, and the support that they need for in their lives to keep their families strong, and also to ensure all of its members have self-determination and productivity. So don't create competing definitions. The other thing it did was our field is not very preventative. We are very crisis-driven. You call us when you need something, and if you need it bad enough compared to somebody else, we might have funding for you. And we needed to get to the point where we needed to give families the tools they need to create the life they need before they go into crisis, or hopefully to prevent them from going into crisis. And we also didn't want the outcome of family support to be to save the service system money. We wanted it to be about how can we create good quality of life for people. And so we realized this is not a program. You're not eligible for it. This is the way we should be talking to all families and all family members. And so that is the reason why we stopped using the phrase family support. Because if you've been in this field long enough, family support has you have a vision in your head of what it always is. So for lack of better words, we call it supporting families, to broaden that sort of understanding. And so across the nation, you're hearing people stop using the phrase family support and start talking about the role of supporting families across the life course. This was a definition that came out, and it kind of served as a national definition. It's been written into some of the national policies, and it's written into a lot of the programs that are being funded coming out of the Administration for Community Living. So families will be supported in the way that maximizes their capacity, strengths, and abilities so they can best support, nurture, love, and facilitate the individual with disabilities or the individual member having the achievement of self-determination, productivity, and inclusion in all facets of their lives. So when we start thinking about family support, we categorize it into three big buckets. And the other thing that we started to do is have the conversation. Our field likes to compete amongst itself so we don't get anywhere. And so for 15 years, we've debated, now, who is that service really for? Because the primary beneficiary is the person with the disability. So if mom's having a better life because of it, we can't fund it because she's not the primary beneficiary. And so we started to kind of think about, it doesn't matter. In these three buckets, there could be things that the individual gets and that the family benefits from. There could be things that the family is getting that the individual benefits from. This is not an eligibility package. This is not your list of services that are provided. These are the types of areas that all people need, really, in any arena. So think about your own life for a second. If you need something, you need to understand it, you need information about it, and you need the skills to make it happen. That's what bucket one is. So whether you're the person with the disability, the sibling, the parent, the grandparent, you need good information to make good decisions. That's why you go to college for some reasons. So think about no matter what you want in your life, you need those three things. You also, the middle bucket is really about how can you connect to other people who understand that. Sometimes it's just connecting to peer support. Sometimes it's siblings talking to other siblings or self-advocates talking to other self-advocates. But you need to build your own confidence in the information you just learned. And you can't do that inside of a vacuum. And lots of times that information comes from talking to other families. And the more you can connect families to other families, the more they can learn from one another. Just like if you sit in a college classroom, you can learn a lot from a book, but until you can go and you learn from professionals that have been there and done it and have tried it and done those things, you can't really understand it. That's the same thing that's true for families with disabilities. What's interesting and different about that, though, is that I would say the number one thing that we get calls about is I need information and I feel alone. And those are the biggest themes when it comes to family support. Aloneness comes from a couple different things. Some of it's true aloneness. I have this parent that we work with, and her daughter has medical needs and can't go into the sun, and on this day the temperature's this, or she's having a seizure. So some of it's because of the actual physical limitations of her child has created her to have to be kind of alone. Others are just the feeling of aloneness, like, everybody else seems to be doing all this other stuff, but I don't feel like I can do it. So the middle piece is really, really important. And then the last piece is the piece that we typically think of first. And so the purpose of this order is to get you to think of it third. And that's the paid services, right? The respite, the accommodations, all of the financial stuff, all of the personal care attendants, and all of those things. We have both trained families And we've trained ourselves to start over there. Oh, what can we pay for you? Where in reality, we should be starting over on the left-hand side and saying, how can we understand where you're at? How can we help you think about that? How can we give you the information you need about either things in your own life or things that might be available? And how can we make sure you're connected to people? And our field jumps straight over there. So when I'm training practitioners, I say to them 3 things. Now, even if you're there and you're overseeing the third bucket, every time you talk to a self-advocate or a family, are you saying to them, are you connecting to others? Do you do it at church, or do you have a specialized chat room online that you go to? How are you connecting to other people? And what information do you need? And we all should be doing that no matter when or why we interact with families. The other thing is we need to spend more time helping families think through creating a vision. So my dissertation, we have partners in policymaking in the state of Missouri for the last 18 years. And so I interviewed parents that went through the Partners in Policymaking program. And what was really interesting about that is so here you have parents who received information. Partners gave them sort of a peer support network to really kind of challenge some of their understandings and information they received. And I said to them, what was the thing that was the most influential for you? And they said, we got a lot of really great practical information, really good speakers, a lot of different tools. But the biggest thing that impacted them was learning that they could have a vision or a dream for their child with a disability. And if you sit and you think about that for a second, we blow over that all the time. And we don't spend a lot of time there. And so we started to kind of really dig into that. And we started to say, okay, so you don't have to give up any of your ages, but think about when you were a child and you were going through school. In your era, your own era, where were kids with disabilities? I grew up in the era where they were in the mobile homes in the parking lot. I grew up in the era where they started in that hallway way down there that you never went to, and then it was kind of the janitor's closet, and then they moved into those mobile homes, right? The kids that are graduating now did not grow up in that same era. Their understanding of inclusion and their hopes and expectation for people with disabilities are totally different than everyone in this room right now. But then you have older generations, in this room or not, who grew up not even having kids in their school buildings, or not maybe ever seeing or interacting with a person with a disability. So then when I would say to the partners grads, the parents, I would say, so you didn't grow up with a family or seeing anybody with a disability. So why is it that we would expect as a field and as a society that people would know how to have an inclusive vision for people with disabilities? If you don't see it, you don't see it being modeled, you don't see it on TV, you don't see it in the neighborhood, you don't see it in your church. Why is it that we as a field just assume parents, because that child was born, they're going to be an advocate for inclusion? There's no way that we can assume that. They didn't grow up with that understanding. They don't see it. Now, many families want it, in their gut, but they're so scared of safety, and they're scared of bullying, and they're scared of all these things that the easiest thing to do is to kind of go put a little cocoon around your family member and keep them safe from this big bad world. But in reality, what happens is the safety net that we put around that person and that child, we did it with Eric. Looking back now, it's oh my gosh, had we given him an opportunity to experience more natural consequences, would we be doing this at 32? Had we given him more opportunities to actually go try to make friends and have to figure that out when he was 4, 5, 6, 7, 18, would he be as lonely as he is right now? So that cocoon of protection actually becomes your detriment when you get older. So the first thing, though, to help do that is how do we help families have a vision for their child at every stage of their life? And I laugh. I laugh because it's if I said to you, we have a planning meeting for this goal down here, what's your plan? What do you want in your IEP? And you would say, but what's the goal? No one ever talks about the goal, so how can I have a step in planning for the goal if I don't know what the goal is? So we wonder why transition planning doesn't really work. People don't know what they're transition planning for. Oftentimes, those families don't even think about life after school. So the first thing we need to do with a family of a child at any age is say, what is the vision you want for their quality of life? Not what services do you want, what's the vision you want? Many, many, many families that I have that conversation with, they put a big fat question mark in there. And they say, I have no idea what a life can look like for my child with autism. I have no idea what a life can look like for a child with significant physical limitations that's hooked up to a machine. But I will tell you, I know what I don't want for my child. I don't want him to live here. I don't want him to do that. So I start with both those bubbles. And I actually, if they can only fill that bottom bubble out, then that's where I spend my energy and my time with that family, giving them examples, introducing them to self-advocates with the same disability, showing them what is possible. Not what services are possible, but like real-life people they can touch and talk to really think about a vision for their family member. The other thing is I kind of use they also have to understand what's possible in terms of different life outcomes. Like it shouldn't say there, I have a vision for my child to live in segregated supports in a small part of our community that no one accesses, right? We don't sit and talk about our lives in terms of like big buckets. Like when you were 16, you didn't like decide what job you were going to have and where you're going to live and then you were done. You were thinking and evolving and learning and exposing yourself to many different things of many different aspects of your life. So I always think about when you go to a dinner party and you're meeting new people. It's the same life questions you ask anybody, right? So it's like, so what do you do? What do you do during the day? So when I'm talking to a self-advocate or a family, it should be, what am I doing? What are you going to do during the day? And their answers, we need to give them answers. It shouldn't be, I don't know. Or it shouldn't be limited to the few things they think are possible. And then if you usually start talking to somebody new, you usually, oh, where are you from? Where did you grow up, right? Those are the same things that we should be talking to them about. And we should then be thinking about their healthy living. That's not just medical services, but we should be thinking about how is someone living healthy? How are they eating healthy? How are they exercising? And we don't just think about safety and security in terms of, does our service system have good quality assurance programs? And does that person have guardianship? And those are often the things people are thinking about. But what are the things that everybody has to have a good life? This concept of anticipatory guidance is something that they use in the medical profession. It's been around since like the 40s. But we don't use it in our field. And the concept is really helping people with disabilities and their families understand the next stage. Understand not just the next stage in terms of the service systems that they should be accessing, but the next stage in terms of the life expectations. So a lot of the materials that you have are really built on this concept right here. And I'm not going to go through it a ton, but I'm going to tell you it's thinking about your life. And I take people through an exercise where I say, I usually like to start when you're 13, like that 13 to 16-year-old stage. And I have people ask themselves, what were you doing when you were 13? You, personally, doing when you were 13. And I have people kind of list those things, and they'll, I get answers from, well, I was in school, or I was volunteering after school, or some other person said, well, I was in the back seat of the car trying to figure out how to French kiss my boyfriend, or, all of these different things that people were experiencing when they were 13, or 15, or 16, or whatever. And then we go through when we talk about the entire life, the different life experiences through your life. When you're in early childhood, you're learning to say no, you're trying to, hit other kids, you're trying to control your environment. All of these experiences are really, really important to who you are today. My challenge, though, back to all of us as families and professionals is it's who talks to families about that? And I will tell you, nobody. Nobody does. Nobody comes into our homes and says, you have a 4-year-old, And although occupational and physical therapy might be really important to you and you think that's all that exists in that child's life, you need to make sure they have friends and they're going to birthday parties. You need to make sure that if in your family home you ask 4-year-olds what they're going to do when they're getting older, that you ask that 4-year-old what they're going to do when they get older. You need to make sure that if siblings are expected to have chores, that that child with a disability has chores, that that child learns how to have a bank account, that that child learns all of the things that your other children in your home are doing. And I say in your home because it's who am I to come in and tell them what parenting style to have. But whatever parenting style they're going to have for the children with or without disabilities in their home, then that's the parenting style they should have with that child. Now, they might have to accommodate and adapt that. The chores might have to be a little different. You might have to help them a little bit. But if we can teach parents to start adapting and accommodating to meet the same expectations as the other peers, then they'll continue to do that throughout their entire life. And so I think back about there's a really big push for self-determination, which I am a huge proponent of. But you don't learn self-determination in a 6-week course in your high school. You don't learn how to be employed having a VR counselor show up at your house. You learn to become employed and you learn to become self-determined through the life experiences that you had throughout your entire life. So when are we as a field going to realize that if we're going to help people achieve these adult outcomes, we have got to start when they're born. We got to start by helping the family unit put those expectations into place, to help them to set up the same disciplining criteria, to set up the chores and all of those things. So when it comes back to the concept of all, this is about all children, regardless of having a disability or not. But we as a field, what can we do to be responsive for what we've created or haven't created? We need to, every time we talk to a family, every time we give them materials, every time we enter into their home, we need to be helping them to anticipate and guide the next stage of their lives, not just navigate the next stage of the service system. And that's a very, very different thing for our field. We also need to be thinking about the supports that nudge us towards a good life. I use the concept of trajectory in a lot of the materials and tools that we have. And the concept is how are we helping families? I usually will have them fill out something. I think you actually have it in here. I'll use it for a second. It's this one. We'll have them think about what they want in their life or what they don't want in that child's life, or the person with the disabilities filling this out themselves. And then we'll have them start thinking about the things that they are doing that are really helping them move into that positive trajectory. For example, I was talking to a mom that has a 5-year-old, and she very much wants an inclusive life for her son and believes in that process. She got to school for kindergarten this year, and the teachers had decided that to keep him safe, they were going to put him in a segregated classroom. He'd be on a special bus in a segregated classroom, and that mom should really understand that this was the best thing that she could do for that kid. And mom went along with it for a little bit. And then we started to talk to mom about what does that safety bubble at 5 going to look like? Is that going to send somebody on a trajectory of understanding how to keep themselves safe in a different environment? Is that going to help them understand how to handle bullies? Is that going to help them understand how to be friends with people and have a protective friendship that might protect you from the bullies? It's not. It's actually going to create you right on this sort of trajectory straight to this isolated life of always needing to be protected. And once you started to understand that, and it's scary and it's risky, and we want to keep our kids in a cocoon, but if we realize helping that family understand that at 5, it's a whole lot easier to do it at 5 than at 18 when you hadn't been doing that, and all of a sudden you're trying to help keep them safe at 18. You can't teach it at 18. So the concept of trajectory is really important. The interesting part about the trajectory concept is it allows us to talk about life experiences and the experiences sending you on positive or negative trajectories. But I also use this exact same worksheet when I'm working with policymakers and say, okay, everyone says employment first policies, that's what we're focused on in our country, right? Employment first, let's put that down there and what we want. Now let's go to 18. When I go to the Social Security office because I need Medicaid, because I need Medicaid waiver, because I need a personal care attendant, because I require 24-hour supports, I am being told I have to go to the Social Security office and deem myself incompetent. So the policies itself are creating a trajectory towards dependence on public services. So it enables us to have this exact same conversation at a policy level that I can do with a person on an expectation level. The other thing is and it's kind of funny because this has actually evolved into 5 things, but I'm going to go with this because that was just last week that it evolved, but is we have a tendency to move straight to formalized eligibility-based supports. Now that doesn't say disability-specific supports, because what we're trying to get people to understand is that there are a lot of supports that are available to you that don't have to just be developmental disability services. You can access housing and food stamps, and there's other types of services and supports that we as a field need to get out of our own bubble and figure out how to access the other community resources available. So, most importantly though, go back to that slide of 75 and 25. We already know that 25% are the only ones that actually get to access the DD formal service system. So what are we doing about the other 25%? Do we ignore them? Kind of. That's how we feel as families. Put you on a waiting list. Well, that doesn't mean my needs are waiting. My needs continue, even though your services aren't available. So we have to figure out a different way to respond to these families. And we have to figure out a different way to think about ourselves and the way we're going to answer them. And so some of the things that people have talked about in our field, we constantly say, oh, you should use your natural supports. And so for the last 3 years, we've been working with stakeholders in our state to say, well, what does that mean? We toss that phrase around in our field like everybody knows what it means. And quite frankly, it's very offensive to a lot of families. Because one, you don't think I tried everything before I picked up the phone to call you? You don't think I ran through all the friends in my life and my family won't answer the phone anymore? You don't think I didn't do all that already? And now you're saying you have the audacity to sit there and say, we're not going to fund you until you try your natural supports. So one, it's offensive to a lot of families. Two, maybe they don't have natural supports. Maybe they're doing this on their own because of lots of reasons, because they feel isolated, they've become isolated, all of those reasons. So we really needed to start figuring out what that meant. So forgetting disability again for a second, we started to think about our own lives and all the different things in our lives that we use to get by throughout the day. You know, I need an alarm clock to get up in the morning. My body does not wake me up in the morning. That's technology I use to get up in the morning. So if I'm a person with a disability, are you teaching me how to use an alarm clock? Or are you teaching me to become dependent on a staff to come pull me out of bed? Thinking about my own lives, I might use public transportation. I might need to be healthy and well, and so I might go to the park. I might go to the YMCA. When I'm thinking about how I get through the day with a 9 and a 12-year-old, which is what I have, being a full-time working mom who travels a lot, how do I get through the day? They're not eligible for DD services. I can't call and ask for respite or personal care attendant services. I have to figure this out. So how do I do it, right? So I think about it. One, I have an incredible husband who helps with it. Two, the kids have family, friends who they go to school with, who those moms help out. They take them to they're on the same soccer teams with them, so they ride together. I was using the example earlier is that I used to have to call childcare and pay for childcare. Well, now they're walking home by themselves, but me being mother hen, they have a cell phone, so I know where they are all the time. When they get home, they FaceTime me so I can physically see they're in my kitchen. And so I'm using technology, whereas before I didn't utilize that. I had to pay for that. So using examples on how we get through life and how that changes every day. Every day I'm using a different part of that to get through my days. That's the kind of thinking we have to help families do with the individual with the disability. And how can we start doing that when they're younger? Instead of just running straight to, well, there'll be a group home that'll take care of all that for you, because that's not the way of the world anymore. And so for my brother's life that grew up in what I call it the group home boom, was in the 80s. He grew up in the era where group homes were not in the state of Missouri. Medicaid waiver, I think this part's an incredible part that I point out, didn't come around until the 80s, which is not that long ago. And when it came around in our state, man, we couldn't build group homes fast enough. And we couldn't get people in them fast enough. Well, now we're in 2010 and we're not funding them anymore. We're shutting them down, we're closing them, we're moving it into individualized supports. That's a pretty quick, here's what you get, and now we're taking it away, right? So Eric grew up in this sort of mentality that we're here as a government, our social contract with families is we're going to take care of them, but we're going to wrap everything around them. We're going to provide their transportation, and we got this figured out. And we built this incredible structure. So much of Eric's life is down here. So for our family, when I'm thinking about Eric and I'm thinking about these circles and I'm thinking about someone in the 25%, my job as a family member and the professionals in his life are to ensure that he's using other things. Because he will have a better quality of life if all of his eggs aren't only in a paid service basket. So our job then is to say, well, can Eric do things with technology that might have always required staff, but can technology help him do some of the same things that we thought a person had to do before? Does he have family and friends in his life that can help provide some of his supports some of the time, not all of the time, but does it make sense? Or are we relying on a 365, 24-hour day paid service system? Are we accessing things in the community, or is he only going to specialized dances and specialized things? It's okay to do that some of the time, but is he doing all of the time? So this can really be used no matter whether you're in the service or out of the service system. So everyone is a starting point. I say that because I have had families call me after I'm done in tears saying, I've screwed up. My kid's 40. I wish I'd known this 40 years ago. The reality is our field didn't think like this 40 years ago. It was very different 40 years ago. And I only have a 9 and a 12-year-old, and I'm still mad about the things I did over the last 9 years. I think that's part of parenting. We can't go back and redo the stuff that we've done. But what we can do is use the starting point of no matter where every person is that we interact with now, whether it's a 55-year-old person with a disability or a 4-year-old. How are you using this thinking to start applying it to their life? Now, your response back to them might be very different because they're very different generations. A 4-year-old, you should have a starting point that really gets them on that inclusive good life trajectory. A 55, 60-year-old that only grew up with a mentality of a more group home era, you're going to have to nudge them where they're at. You're not going to be able just to kind of do some of our real innovative things. So real quickly, because I know we have about another 20 minutes before we do questions, what does this look like in our lives? Our field has a tendency to talk about legacy services, group homes, specialized supports, and all that stuff as if they're negative. But in reality, we are where we are today because of the evolution we've done as a field. And so how can we really think about, I always talk about uncharted waters, and people say, well, that sounds scary. And I said, no, it actually sounds more like life. Because for some reason, we think that we can plan a person's life with a disability and just be done with it. Oh, we figured out where you're going to live. Forever. No one lives there forever. We figured out the job that, oh my gosh, you've had for 70 years and you've never retired. We have very uncharted lives. That's the life we want for people with disabilities. We don't want them to go off to that nice little cottage and be there and be done with them. That's not a quality of life. There's no risk in there. There's no dignity in there. There's no quality of life in there. So I use the phrase charted to kind of help people start with, charted is stuff that's known, stuff you're familiar with. Slightly charted is stuff that maybe you've heard of, but maybe it's not all the way across your state. It's not everybody's using it. You've heard other states using it. Uncharted is something new or unfamiliar. And then the last one I put there is the unknown. And I use the example of the telephone. The telephone is something that when it came about, we never got rid of the telephone. We don't need to get rid of supports, but the support systems have to evolve. So we started out with the rotary phone, It evolved into a cordless phone. I mean, how exciting as a 16-year-old girl to be able to like take that in the bathroom, not have the cord come all the way from the kitchen, right? Things evolved. And now if you look at Uncharted, we have cell phones that we're using. But we can't think for 1 second that these cell phone companies aren't coming out with something that we don't know about yet. So I use that example when I'm talking to families, and I say, what is your sort of vision for your future? Well, it might fall in one of those arenas, but then our job is to help them think about the other ones. When I'm talking, I use it specifically when I'm talking to providers, and I say to a provider in our state, you know what? Back in the day, sheltered workshops were innovative. Sheltered workshops have now become something traditional in our service system. And I don't know about you, but do you still use your rotary phone? And if you don't, do you think we're always going to use sheltered workshops? Or is that function needing to continue to evolve with our service system? So it's just a language to be able to help people think about that. So we kind of use that language, and in your folder, don't get it now, we kind of give some examples of each of those levels for each of the different life domains to get people to start thinking first that there's lots of pieces of a person's life. It's not just as simple as going into residential supports and everything's done. That housing has separated from services, which is separated from transportation and medical supports. So for us, because we were the group home era, services and supports were our main sort of anxiety in Eric's life, right? We didn't graduate thinking about Eric being employed, because that's not what you did with people with disabilities graduating in the 80s. So we were really concerned about his services and supports. Eric has had the opportunity to live in many different residential services because none of them worked for Eric. And as hard as life has been at times for us, because Eric has behavioral issues at times, it's been Eric's greatest godsend of being able to challenge the traditional service system and force us to have to create an individualized life for him, which sounds really, really strange, but had Eric not had those behaviors, in the 80s, he would have fit in nicely in that nice little compliant group home. He would have fit in nicely into that nice little sheltered workshop, but he did not fit into those things that were available to people with disabilities back then. Scary. I remember my dad saying, what are you talking about? That's what our world has created for people with disabilities, and he has a disability and he's not allowed into his world, so where is he supposed to go? Obviously, he thinks differently about it now, but it required us to create a very individualized life. Hard, challenging. We went through the institution. He then lived in a group home. He then lived in an independent supporting living apartment that was run and controlled by the agency. All the while, it wasn't working. He wasn't having a good quality of life. Behaviors didn't decrease. His quality of life wasn't good. And then we didn't know what to do. We didn't know what to do. And I had the opportunity to go to the Delaware Leadership Institute, met and learned about shared living concepts, and that fit our value base as a family, and it fit our lifestyle. We were able to, and ironically, the timing was crazy. There was a provider in our state who had opened the doors in St. Louis and was only going to do companion models. And wasn't going to do foster family models, but they were going to do a companion model. And they couldn't find anybody to do it because it was too progressive for families because they didn't understand it. And Eric was living at the ISL at the time, and I got back and I sent a letter to his provider. Didn't know I was going to go the companion route at that point, and just said, Eric's behaviors have now become new behaviors. He's depressed, not getting out of bed. You're calling 911 probably once a week. The ambulances and the police are showing up, which ironically are Eric's favorite things. And it was not good. It was not good. And so what did the service system do? They upped his meds, created a new behavioral plan, and they gave him a 3-on-1 staffing ratio. Well, I mean, who's happy there? So my letter to them was, I think we need to get together, the people that love and know Eric, and have a conversation. And we need to see maybe what really we should be focusing on, because he's not even leaving his apartment at this point. Needless to say, they sent a 30-day notice and says they cannot live up to the expectations set by his sister, and that we had 30 days to get him out of there. Before the 30 days came up, it was about a week later. The next time they called 911, they put in an ambulance and said, don't call us. We're not going with you. We're done. So needless to say, my parents didn't find out till 36 hours later that he was still in the ER because he couldn't communicate, no one knew who he was, didn't have his paperwork or anything. These are the things that families experience just because they wanted to talk to them. Just because I didn't think I was doing anything beyond just saying, how can we work on this together? So again, it was horrific. My mom called me in hysterics, and I was in Kansas City and she was in St. Louis, and said, what do we do? Because they found out. They got a call from the case manager who finally found out that Eric was there and then tried to locate my parents. It's sad to say, but the first thing I said to him was, go to that apartment tonight and you clear it out. It's all his stuff. They're going to lock the door in the morning and get all of his stuff out. And send Dad to the hospital to go get Eric. So you're having to do some really interesting things to counter the service system, which you believed was built to help you. And in some ways, the things that we've done in Eric's life are to protect him from the service system itself. I'm a firm believer of people not having guardians, but to be quite frankly, for someone that's getting 24-hour supports from the service system, we were forced to have to get it because the service system said, you're not the guardian. We don't have to tell you. And so the things that have happened in his life, one, has gotten us to the point where we're at right now, which he has a really good life right now. But we're constantly, as a family, waiting for the shoe to drop somewhere. The staffing will change, the provider will change. The Department of Labor changed a rule around how you pay people who are direct care workers. That's killing the companion model. They're thinking about shutting all the companion models across the country down now. Whoever dreamed of that policy impacting my brother's life? But it is. It's a reality. So needless to say, this is his companion, and that's his companion's fiance. So just like other adult siblings go off and get married and start their own family cycle, Eric's family cycle has started very differently, but he has a family cycle now. This is his house. The second we recognized separating housing from services and what that really meant as a family, everything changed. And the reason it changed was now that Eric owns that house or rents a house, it doesn't matter, but once Eric's name's on that lease or that mortgage, who gets to fire who? We get to fire the agency. The agency doesn't fire Eric from living in that environment. So the consistent thing in his life is where he lives, and that's what's important to you and I. And so that power dynamic changed. It's his home now. If things work out where his staff that doesn't work out, or the agency doesn't work out, you know what? Eric stays, they leave. A total change in the dynamics. Employment, we didn't care about employment. Not that we don't care about it. We're finally able to have those conversations now because those other two things were stabilized in our life. Now, if Eric had graduated from high school right now where employment is the focus, we actually might have started with this slide. But the life course domains allow you to start with the slide that's the most important to that family unit or to that individual. So now we're actually finally able to say, you know what, can we find a very meaningful day? Are there things that Eric can be employed to do? We've got some of this other stuff figured out. So this is a good life for Eric. We have a house, the summer house on the Mississippi River, and he loves to smoke cigars. That's my dad and Eric smoking cigars. That's Eric's girlfriend, Erica, at New Year's Eve. So really exciting, gets to have a girlfriend, but they both receive services from our service system. So she lives in a group home. Have you ever tried to get two people in the service system together who live in two different agencies? Well, you can't hardly do it. So, for example, we'll call and say Eric wants to go on a date with Erica. Oh, our staff can't have non-clients in our car. It's a liability issue. Or, oh, you know, the group home's doing laundry that night. So we're constantly having to fight the rules of the service system to even have them get together as a couple. But it doesn't stop us. You keep going. Eric loves his nephews. So it's really important for him to spend time with his nephews that are in and out of the state. Eric despises therapeutic horsemanship. So I put that up there. Because, well, come on. We fought and got him services and we got him supports and figured out how to get him into it. We thought it was great. Dad got on the board, and Eric hated it. So it's really important to also know what people don't like in their lives as well, and to really recognize that. We don't have to like everything. So this is our good life, our family's good life. We're able to spend time together as a family, as family members, and do things that families should be doing together. I shared this picture because this was my dad's retirement party 2 years ago. And I share it because when he retired, unbeknownst to us, he got put in to Medicare, and he got a new amount of a Social Security or SSDI check, which kicked him off of Medicaid waiver. Which then when he called Medicare and told them that you don't want it, they say you have to have it because it's better than Medicaid. And we keep saying, no, but he needs his Medicaid waiver dollars because it pays for his residential supports. And it was a 3-month battle of fighting with every one of these service systems to convince them that they had no idea what they were talking about. So whether Eric lives at home or not, the parents' Social Security and retirement can impact the people you support. All of a sudden, he's on, getting all this new paperwork. All of a sudden, his only $1,000 a month that he was receiving was over that. He lost his housing, he lost his food stamps. I mean, everything changed within that month. And every professional we called didn't see it as a major problem. And so luckily, Dad was retired and could spend 4 or 5 hours a day for 3 months to figure that out. Families don't have the time, the knowledge, or the skills to do that. That is really unfair. So we have to figure out how to think about how our systems are integrated together so this doesn't happen to every family that decides to retire. So what does this look like? The significant problems we face today cannot be solved at the same level we created them, which is the reason for the reframing of the new paradigm. We can't keep responding the same way. We must focus on life outcomes and not on service outcomes. We need to stop going into families' homes or the individuals' homes and making sure that the important thing is in our state that the water temperature is a certain range, that the milk is not expired. Those things are important, but more importantly, are we helping people have quality of life? So our service systems need to obviously ensure health and safety, but we need to push beyond that to look at quality of life outcomes. We must think across generations. Here's Tennessee's, and again, I apologize for not doing North Carolina's, but we can't respond the same way for every generation for a couple different reasons. One, if we keep responding to people who are graduating from high school and saying to them, well, I'll just put you on that wait list till that 24-hour residential option comes available, that individual is going to be in a residential service system now for the next 60 years because people are living longer. Financially, we can't add all these numbers up and give everyone a 24-hour residential life, even if that's what we thought everyone deserved. We can't financially, as a nation, afford that system. So we have to be thinking about how we respond to people. So if someone is 60 with a disability comes to us, the options that we, and the life that we, and the services that we provide for them would look very different than if a 17 or an 18-year-old comes in. But right now, we offer them the exact same service packages, as if they're the same. But I would hope that an 18-year-old coming in, that we can do some different things that are more innovative and help them integrate this sort of life, that then maybe they can use the rest of their life. And if they do require 24-hour services at some point, then it could look very differently how they access those. So we have to think across generations for that reason. We also have to think across generations because, one, because they need things differently because of their age, but their thinking is very different. The thinking of a 65-year-old with a disability is, I'm scared of the service system. You used to want to come take me away and put me in an institution. I don't want you in my life. And so there are a lot of people who are older who don't want or don't know how to interact with our service system. Then we have this next generation that finally have grown up and graduated with full IDA, their entire careers of school. They don't want the same things. They don't want the same things that we've built for them. So I use the concept of the public health framework and kind of play off of that. And if you think about it, when we're thinking about the flu, we want hospitals and doctors to be the best hospitals and doctors to respond to the flu as possible. But we know if every American got the flu, the hospital doesn't have the capacity to respond to every American with the flu. So what have we done? We've talked about the flu shot. We're having people get the flu shot to decrease the number of people that need that really great medical system. Not only have the medical professionals said, go get the flu shot, now you can get it at CVS, you can get it at your church, you can get it at your school. The community has started to own getting people the flu shot and taken responsibility for that. But go one step further. Society as a whole now recognizes the importance of washing your hands, which in a way helps prevent the flu and spread the flu, and hopefully then you won't need that really good hospital. So now when you go in the bathroom and someone doesn't wash your hand, you go, ew, right? So society kind of owned not sharing the germs. But more importantly, businesses have soap in the bathroom. They have antibacterial stuff everywhere. But do businesses call the hospital and ask them to pay for it? They don't. So how can we use this level of thinking to think about a new way to think about our service system? One, let's think about the hospital as a parallel to our service system, to having a really great person-centered, self-determined system, because the reality is there are people in our world that are going to always require 24-hour supports. That the other supports aren't going to be enough, but they will always require somebody in their life to care for their day-to-day needs. The other thing is so then what do? If we can't afford that for everybody? We need to be starting to think about some of our responses as part of the flu analogy. So family and self-advocacy networks, inclusive classrooms, adaptive equipment. What are some of our more specialized things that can serve almost like the flu shot? But most importantly, we need to be working down here. And we need to be thinking about how can the communities and how can society start owning inclusion, just like they've started to own washing your hands and not spreading germs. So how can we do it so that if a person with a disability is being bullied, the community stops that from happening? If we see things happening to people, that changes the way we have to actually have a responsibility as a professional. We aren't only responsible to people over in the eligibility-based systems. So how can we help ensure that the church or the faith-based place that the family is going is fully inclusive, both physically and attitudinally? Because if I can go to a place like a church or a community center and participate as a community member, and I'm a mom of a child with a disability, do you know what? I might not need to call the service system and ask them for respite, because I just got it because I was included in my church. And I had a couple hours because I knew my child was safe off with the other peers. So the more inclusive we make this, the less demand it is for that specialized services on that side. I don't know if many of you have talked about it, but I like to use the grocery cart example. And I will tell you, there's not a family that has a child with a disability that does not have a grocery store nightmare. I experienced it when I was 17, when I took my brother to the grocery store thinking I was going to run down there, grab something really fast for my mom, and there was an explosion, a behavioral explosion in the middle of the aisle at 5:30 on a Thursday night. And here I am at 16, trying to be cool. You don't like people to stare at you, right? And here is this going on. So you've got the people that are staring, you got the people that want to help, and you're going, please don't come near me. He's going to hit you. Don't come near us. And then you got people that are pissed because they want to go down the aisle. Everybody has a grocery store experience. But the reality is we need food. We need to eat. We're a family. Like, we all need to eat. So when I heard this year that there is an adult-sized grocery cart, or the grocery cart that is made for adults with disabilities, and grocery stores can call and get that if their customers ask for it, that's a part of the community owning inclusion. And not only owning inclusion of that adult with a disability, they also made it easier for mom to go to the grocery store. It doesn't take away all of it, but that's part of putting the antibacterial soap in the bathroom. So how can we do that more? How can we actually use our service system, our roles as professionals, as DD councils, as USEDs, as family networks, to actually do direct services for families of the 25%, but to also start really putting some of our energy and intervention and focus on building this sort of stuff over here. And so that's something to start thinking about guiding your work. How can we also not make our policies feel like this for families? So I talked to one professional, it's all about inclusion. That school was really great. They were a positive behavioral support school. It was fantastic. And then I got to junior high. And you know what? They wanted them in a specialized classroom. They were restraining them. Oh, but then I get to high school, and that was wonderful. I mean, our lives are the policies and cultures that we experience from professionals and from community members is like this. So we never know. We're like, could someone just tell us? Well, everyone's going to tell us something differently. So until we can start organizing our policies and their culture of all of our systems, and both inside and outside of the disability arena, it's got to feel more like this for families. We've got to align it better, so that if I go into the pediatric office, he understands what a good life for an adult looks like. So when I go into schools, they have the same sort of vision. Otherwise, we sort of feel like we're just being bombarded and pushed all over the place. So ultimately, what was the entire talk about? It was just about all people having the same right, the right to live, love, work, and play together in our communities. So a lot of the stuff that I talked about is on our website. There are presentations on there, but more importantly, we've been developing different tools for applying this thinking at an organizational level for strategic thinking, but also we've been developing tools for families to use. And I phrase it like that, is we've been developing tools for families and self-advocates to use, and then we train professionals on how to use them, as opposed to saying we're developing tools for professionals to use with families. Because there is a difference there. We spend a lot of our energy training professionals, but that means that only 25% get to access it. So we want to develop tools that the 100% can access, but that our service systems want to use when they are interacting with families. So you can access those on our website. The community of practice that I mentioned earlier is a place for everyone to join. Our listservs, we'll be having national webinars, our Facebook page, where we talk about this, the states talk about this, and we share resources. So feel free for anyone to sign up on that. And a lot of these, that information is on these sheets, and you'll have the PowerPoint available. This is my contact information. I love to talk about this. I love to talk about it at an individual personal level with families. I love to talk about it with professionals who are trying to understand it and apply it to their day-to-day. I love talking about it at an organizational, strategic thinking level or a policy level. And so I know people put their numbers up there and you're like, well, why would I ever call them? Call me. It's really no big deal. It's awesome to talk about how to use these tools and adapt them for what you guys want to do here in your state. So with that. So the presentation that I just gave in an hour and a half, I do in a day typically. And then we talk about it and we start using the tools and stuff. And so this is really a very fast, down and dirty introduction for North Carolina because we hadn't been here yet. So, so please do know that. I know that it was probably very fast for some of you. Are there any questions or comments or reflections?
If you don't mind going back to the family support slide.
The one with the family support, supporting families?
Yeah.
Yeah.
And I love the supporting families as an ideal, and that's certainly how we should be, our program should be evolving, and we should be moving towards that. However, in the present, I feel, in my situation, kind of forced to frame, specifically addressing the last bullet on the family support in terms of in order to keep the resources that we have available to us and the supports we have available to us now, we need to frame it in such a way as in you're spending less money on that than you would be if we succumbed and gave it up and let you take care of it. um,
Right here is not about you or your family. This is actually about the infrastructure the service system has done. So you're only using their own argument to talk their language. And there are times you have to do that. I mean, this is kind of it's been an interesting conversation across the nation, because when we're sitting around and I'm talking to just state developmental disability directors, I use this speak because that's their speak, right? They're like, oh, that's really cute. You want to talk about quality of life. But at this point, I got this budget and this many people and this economic crisis. So you frame your conversation for your end audience, and that's all you're doing. So you're not saying I'm not believing in this right-hand column. What you're saying is in order to have a conversation with the state service system, I got to speak their speak, and this is their speak. And so this is the larger philosophical underpinning of your belief system, but this is the speak that you need to have. And I don't want for a second up here to say that family support can't become a program, because there are things about it that are very specific services and programs within it, but we have to recognize that's a piece of the larger umbrella. But don't feel like ever, I mean, there are times, depending on who I talk to, I change my language because you have to talk, I don't like to use some of the words in our field that are offensive, but there's sometimes you're talking to some people that only understand the more traditional language or who don't really understand family support, so I have to talk to them that way. So you're just responding to your audience.
Not working? Oh, there it goes. Oh, gee.
How about if I talk really? Yeah, that works. And I'll just repeat your question if they need it on the thing.
Okay, I have two thoughts going through my head. The first one is the traditional support, such as SSI, which took me over 2 years for my daughter, when she should have been a slam dunk.
Right.
And she very much wants to work and can work about 15 hours a week. She works 10 hours a week at a kennel. She gets minimum wage, and I have to send in all of her pay stubs, and so her pay just keeps going down and down. Now, she doesn't really understand money, and I'm not really telling her about that, and that's okay while I'm alive.
Right.
But this is like punishment. I mean, there's no way she could even live outside of my house on what her full check would be. Say nothing about, I mean, I provide for just about everything, but she's really being punished for wanting to work and wanting to have a good life and doing things that she enjoys.
That's exactly the point of that slide, and that's exactly where the conversation is nationally, because I am a big proponent of employment if it makes sense, but I've had that conversation with my own mom that says it doesn't make sense. It does not make sense for taxpayers to pay for all of these employment supports for Eric where he's never going to financially be economically sufficient enough. Where is the balance here of, and that right there is you are hitting a conversation that's being had nationally, because that's where the employment first is taken to us, and as people are putting it into practice, those are the real challenges, and yeah, that's a real issue.
And secondly, there's another layer to this. My daughter has an invisible physical disability. She has autism spectrum disorder. She looks
It is. We just had that conversation at breakfast this morning, and if you think about the evolution of the disability world, it was starting with physical disabilities, and then we moved more to the cognitive disabilities, and although it's not great, I think the era of really recognizing social emotional differences and more of the invisible disabilities, that's at our doorstep. I don't know how we're going to respond to it, but that's really our next sort of wave of really focusing, and we're being hit at it in a number of different angles of the autism groups and the mental health issues, and it's kind of really becoming this sort of next thing that hopefully society gets a little bit more focused on.
The only thing I can think of to say is, if she was blind, would you ask her to squint harder so she could see?
Right. Yeah, it's a sad world when I've had conversations with my father that said, "Thank goodness you can tell Eric at times, because he's bigger and does some things that don't make sense." And that's a sad world. And so, you hope that society is becoming more accepting of all uniquenesses of all individuals. And, as much as we are talking about bullying in school, I really think the next generation, my children only know they only know of seeing people who are very different. I would hope that when they graduate, that helps for some of the things we're talking about today. And we only have our generational understanding. We don't understand what it's like to grow up with a youth that fully includes people like your daughter. So I do have hope in the future. It's not a great answer, but I really do have hope that'll change. But there are a lot of complexities to that, especially the hidden disabilities. Yes.
So on the integrated support, you have those 4 areas.
Yeah.
What's the 5th?
So the 5th one, and actually your star is, yeah, my mic doing that now? Or is she out there still messing with that?
The mic is off, so it may be yours.
So this is the new star, and the stakeholders worked on it, so I will get it the full thing too. But there's the recognition of your own personal strengths and assets you bring to the table. And so Connecticut is using it with their service coordinators from their state service systems, and they use it, the 5 on the fingers. And they talk about, well, what did you bring to the table? Can you do it yourself? Does your family help you with it? So it could be like, well, you could drive yourself. So where do we ever recognize that? This is muted, so I don't know why. And maybe it's something that's happening. I do. Okay. Oh, excellent. Yeah, and call, there's a ton of stuff that the adult siblings are doing. I don't know if you're on Sibling Leadership Network Facebook page. There's an adult siblings like you and I. There's us all over the world actually on this Facebook page. And it's the Sibling Leadership Network. I highly suggest you go to that.
Yeah.
And then Bryce, who just got do you know Bryce? Okay, I just met him, but I'd like to introduce you to him. So he was just awarded a grant to help create a statewide adult sibling network. And he's a sibling that was talking about sibling issues. So I wanted to connect you because he's exactly what you need for what we were talking about earlier.
Yeah, we started a grant in October. We're looking at creating a chapter of the Sibling Leadership Network, which is a national network in North Carolina, at the end of this 3-year grant. So at the beginning part, we're just gathering a lot of information, kind of building that network. So I'd love to get your contact information.
Yeah, we spoke before I talked, and I think he would has a lot to offer as well. you got to the adult services center, you're feeling a lot of the inadequacies of that infrastructure. Well, hopefully, and there are people here from your state who are working and tackling on this issue who also might be a really good for your mom to talk to. So I don't know how connected you are to your own family network resources, which I'm not that knowledgeable about, but you are.
Yes.
Are you a student
A
here?
student? Oh, okay, great. I was going to say, why don't I give you one of my cards and you can give us a call.